All right, so today we're doing a deep dive, and we're going to be looking at some lecture notes from a social work course.
Okay.
And we're going to be looking at how social workers, really approach helping people.
Yeah.
And it's interesting to consider, like when you think about it, what does it really mean to help someone?
Yeah.
It's a question that I think is, it gets right to the heart of what social work is all about.
Yeah, absolutely. And I think social work really emphasizes that it goes beyond just sort of giving advice,
Right.
but really understanding,
Yeah.
a person in their environment.
Yeah.
So we think about families, communities, even those larger societal forces
Right.
that shape a person's experiences and try to take that all into account.
So these notes, right off the bat, they jump into this concept of direct social work practice.
Okay.
And one of the things I found really interesting is that it's not just about, like reacting to problems that are already there, but it's also about preventing problems
Right.
in the first place. And then also equipping people with the tools to be able to handle challenges on their own, like independently.
Yeah, and I think that speaks to, the core values of social work, right?
Yeah.
Like our commitment to social justice
Yes.
and empowerment.
Yeah.
We are committed to addressing immediate needs, obviously.
Of course.
But it doesn't stop there, you know?
Yeah.
We
Yeah.
really advocate for lasting change.
Yeah.
And I think that's one of the things that, makes social work unique.
Yeah, definitely. And, and speaking of empowerment, these notes really highlight this idea of strengths-oriented practice, which is really fascinating.
Yep.
So it talks about looking at a client's treatment history, their family dynamics, their involvement in the community.
Yeah.
It's almost like, you're viewing these problems as potential, like, springboards for growth, which is really cool.
Exactly. Yeah, because we're recognizing that everyone has strengths, even in the midst of challenges. And really the goal is to build on those strengths.
Right.
So kind of like the risk and resilience framework
Okay.
that was mentioned in the notes. We're looking at both the challenges that people face or risks,
Right.
but also the resources and the strengths that they have that can help them overcome those challenges, those protective factors.
So can you give an example of how a social worker might use that, like the risk and resilience framework, in a real life situation?
Sure, yeah. So let's say we have a young person
Okay.
who's having like some academic difficulties.
Okay.
So applying the risk and resilience framework, a social worker wouldn't just focus on the grades
Right.
or the behavior in school, but we'd also look at, are there stressors at home?
Okay.
Like, is there a family illness going on?
Yeah.
Are there financial strains?
Right.
Things like that.
Okay.
And then we look at what are the supports.
Okay.
So does this young person have strong friendships?
Right.
Do they have a teacher that they feel really connected to?
Yeah.
Are they involved in a community youth group?
Right. So those are all protective factors
Yep.
that we can build on to help the young person kind of navigate the academic challenges.
So it's about really looking beyond just like the very surface of, what you see.
Absolutely.
Like, what is the full context
Yeah.
of this person's life and how are all these factors interplaying?
Exactly.
And speaking of context, one of the things that these notes also really highlighted was this idea of diversity and multiculturalism.
Okay.
And it really emphasizes the importance of cultural competence for social workers,
Yeah, for sure.
which I think is so crucial. And it talks about,
Yeah. And it's not just about being aware of different cultures,
Right.
but also, like you're saying, understanding the context.
Yeah.
So how might those cultural differences influence a person's experiences?
right.
And then how do we as social workers tailor our approach
Yes.
so that we're being sensitive to those differences? Yeah. And I thought it was really interesting. The notes talk about the difference between cultural knowledge,
Right.
which is like actually understanding, the specifics of someone's background, versus cultural sensitivity,
Right.
which is like really applying that knowledge with respect and understanding,
Absolutely.
and recognizing that everyone is an individual.
Mm-hmm.
And it's about really listening and learning from our clients, especially those whose, backgrounds and experiences might be different from our own.
Absolutely. And I think it's about creating that space where people feel safe
Right.
to share their experiences.
Yes.
And recognizing that, a person's cultural background
Yeah.
can really affect their perspectives,
Yeah.
their value,
Yeah.
even how they view, the role of a social worker.
Right, absolutely. And then that kind of leads us, very naturally to this concept of client empowerment, which I think is really at the core of social work practice, right?
Right.
It's about helping people gain control over their own lives?
Yeah. And these notes break it down
Okay.
into three main themes of empowerment.
Okay.
So, first you have personal growth,
Okay.
then fostering positive social change,
Yes.
and then, importantly, liberation from oppression.
Wow.
So really working on multiple levels to create change.
Yeah, and one of the things that I found myself really drawn to in these notes was this section on spirituality and direct practice,
Ah.
which I think can sometimes feel, maybe a little bit intimidating or like a sensitive area, but it's so important.
It is, yeah.
Like, how do spiritual beliefs, existential anxieties, how do those things actually affect a person's, like, well-being?
Yeah, and I think the
'Cause it's
notes
so important.
really emphasize that
Yeah.
these are things that can deeply impact people.
Right.
Things like, fear of death or just this feeling of being isolated
Right.
can really affect people in very profound ways.
Yeah. And, what's interesting is the notes also acknowledge that, incorporating spirituality into social work practice isn't always straightforward.
Yeah.
There are some ethical considerations. There are some potential challenges there.
Right, right. And the notes actually outline
Yeah.
4 key challenges that social workers face when it comes to integrating spirituality.
Okay.
So the first one is about understanding the social worker's own existential issues.
Oh, interesting.
So how might our own beliefs,
Right.
subtly influence how we're working with clients?
Right. So you have to be very self-aware.
Yeah, yeah, yeah.
And I guess that also kind of ties into the second challenge that they mentioned, right?
Yeah, yeah. So the second one is about, like you said, understanding and respecting the client context of meaning.
Right.
So what is their belief system?
Right.
What gives their life meaning?
Right.
And again, avoiding judgment.
Right.
Avoiding, trying to push our own beliefs on people.
Of course.
But really meeting them where they're at.
Yeah.
And understanding their worldview.
Right.
And then the third one is about encouraging disclosure, but recognizing that it's not always appropriate.
Right.
So kind of sensing those cues from the client.
Yeah.
Knowing when it's okay to encourage them to talk about these things.
Yes.
And when maybe it's better to just focus on other aspects
Yeah.
of their well-being.
And then the final one, if I remember correctly, was helping clients to find meaning and purpose.
Exactly.
Like to find that sense of direction in their lives.
Absolutely.
So that they can, kind of make positive choices and move forward.
Yeah, it's not just about exploring those concepts in theory.
Right.
But how do they actually, connect their beliefs to their everyday lives, to actions?
Wow. It's amazing how much, like, depth and complexity are packed into these seemingly, simple lecture notes.
Yeah, it's really fascinating.
And as we've been talking, I keep thinking back to this section on the limitations of empowerment practice. And I found myself really kind of struck by that section.
I'm curious why that resonated with you.
Well, because, it talks about how some clients might actually prefer like a more traditional approach.
Okay.
Where the social worker is kind of like the expert and is providing, more clear guidance.
Right, right.
And it made me realize that empowerment isn't necessarily a one-size-fits-all concept.
Right. And it kind of challenges that assumption that everyone wants to be
Right.
Fully in control, or that everyone even feels comfortable taking on that role in the therapeutic process.
Yeah. So how do social workers navigate that potential conflict?
Right.
How do you balance, respecting a client's desire for that kind of expert guidance while still trying to empower them to take ownership?
It's a tricky balance, for sure.
It's like a tightrope walk.
It is, because at the heart of our profession is this deep respect for the client's self-determination.
Right.
Right. Their right to make choices.
Right.
But we also recognize that sometimes people need support. They need guidance.
Right.
Maybe even a little direction.
Yeah.
Especially when they're facing really difficult challenges.
So it's about, really meeting the client where they are.
Yeah.
Understanding their individual needs.
Absolutely.
And their preferences, right? Because some people might, totally thrive in that, really collaborative partnership where they're, empowered to make decisions.
Yeah.
But other people might feel a lot more secure with a more directive approach.
Yeah, absolutely.
And it makes me think about, this concept of informed consent, which you hear a lot about in healthcare.
Right.
But I think it's really relevant in social work as well,
Absolutely.
Making sure that the client really understands the different approaches, the potential benefits and risks, and
Wow.
then can make an informed choice about what kind of relationship.
Absolutely. Yeah, I think transparency
Right.
and shared decision-making are key.
Yeah, yeah.
So as a social worker, we can lay out the options, we can explain the empowerment model, but ultimately it's up to the client
Right.
to decide what feels right.
And that choice can evolve over time too, right?
Yeah.
Like as the client, gains confidence, develops new skills, maybe they shift.
Exactly. It's not static.
Right.
It's an ongoing process.
Yeah.
And I think as social workers, we need to be attuned to that,
Yeah.
to those changes, to the client's evolving sense of agency, and be willing to adjust,
Yeah.
our approach.
Yeah. So it's about being flexible and adaptable.
Absolutely.
So there's not like one right way to do this work.
Yeah.
It's really about.
It's about being responsive to the client.
Yeah. Yeah.
And their needs.
And it makes me wonder, too, about, how cultural factors might influence this as well. We touched on cultural competence earlier, but, how might different cultural perspectives influence a client's, preference for a more directive or a more collaborative approach?
That's such a great point. Yeah.
Cultural values around authority.
Yeah.
Interdependence,
Absolutely.
decision-making, all of those things can really shape how someone views the role of the social worker
Right.
and their own role in the process.
Yeah. So, for example, in some cultures, there's a strong emphasis on respecting elders.
Right.
Or those in positions of authority.
Right.
So a client from that background might feel more comfortable with a more hierarchical relationship.
Yeah, right.
Where the social worker is seen as the expert.
Right. And then in other cultures where there's more emphasis on community involvement,
right.
Or shared decision making, then maybe a more collaborative approach.
Exactly. Yeah, it really highlights the importance of cultural humility.
Yeah.
Recognizing that our own assumptions and our biases might influence how we're perceiving a client's needs and preferences.
And being really open to learning from our clients, right?
Yeah.
And really understanding their perspective and then adapting our approach.
Absolutely.
To fit, their cultural values.
And I think that might even mean challenging our own preconceived notions of what empowerment should look like.
Yeah.
Because it might look different
in
different cultural contexts.
This conversation is just making me realize how nuanced
it is
and complex social work practice really is.
Yeah.
It's not just about applying a set of theories. It's about navigating these really intricate human relationships.
Absolutely.
It's about cultural differences. It's about ethical considerations.
Yeah, I think that's why
it's
ongoing self-reflection
Yeah.
and professional development are so important for social workers.
Because we have to constantly examine, our own biases.
Right.
We have to expand our knowledge base. We have to refine our skills,
Absolutely.
to make sure that we're really providing effective and empowering support.
Yeah, and I think that's a great point. We've been talking a lot about the client's perspective.
Right.
But I'm wondering, what about the social worker?
Yeah.
What does it take for a social worker to feel empowered in their role?
That's such a good question because I feel like, if the social worker doesn't feel empowered,
right,
how can they possibly empower, their client?
Exactly. Yeah. So I think a social worker's own sense of empowerment is really key to their effectiveness.
Yeah.
And I think it comes from a few things.
Okay.
First and foremost, I think having a strong foundation
Yeah.
in social work values and ethics.
So knowing what you stand for.
Exactly.
What are those core principles that are guiding?
Yeah, it's like having that moral compass.
Yes, to guide you through all those ethical dilemmas.
Exactly.
Yeah.
And then secondly, I think feeling competent in your skills and knowledge.
Right. So you have that confidence too.
Yeah. So you feel you can actually assess situations. You can come up with interventions that are going to be effective.
Yeah.
You can advocate for your clients.
Right.
All of that is really empowering.
It makes me think of that saying, knowledge is power,
Absolutely.
The more you know, the more you feel equipped to actually make a difference.
Mm-hmm.
And then third, I would say feeling supported in your work environment, having colleagues that you can collaborate with, having supervisors who are going to provide guidance and mentorship, having an organizational culture that actually values, social work principles, all of that really contributes.
Yeah, because it's such demanding work.
Yeah.
You're dealing with really heavy issues.
It's emotionally intense.
You're facing systemic barriers.
Yes, right.
Sometimes you're even putting yourself at risk.
Yeah.
So you need that support.
To prevent burnout.
Absolutely.
Yeah.
To keep that passion going.
Yeah, and I would add to that list a strong sense of self-care as well.
Oh, for sure, for sure.
Because social workers often pour so much of themselves into this work. It's so crucial that they're also taking care of their own well-being.
Right, and I think that's something...
Whether it's, mindfulness or spending time in nature or, whatever it is, that brings them joy and replenishes them.
I think that's something that I've learned over time.
Yeah.
Early in my career, I definitely fell into that trap of overworking.
Yeah.
Taking on too much, not setting boundaries.
Right.
And it led to burnout.
Right.
And so what I've learned is that self-care isn't selfish.
Right.
It's absolutely essential.
Right, like that oxygen mask analogy, right?
Exactly.
You have to put on your own oxygen mask before you can help the person next to you.
And I think a lot of people in helping professions especially struggle with that.
Yeah.
But for me, I found that if I'm not taking care of myself,
right,
both physically and emotionally, I'm not going to be able to show up for my clients in the way that they deserve.
Yeah. So what are some things that, how do you personally prioritize self-care?
Yeah. So for me, it's about finding activities that bring me joy
okay,
and replenish my energy.
Okay.
So, it might be spending time in nature. It might be doing yoga. It might be listening to music or even just, taking a few minutes to meditate each day.
Yeah.
Just quiet the mind a little bit.
Yeah.
So it's different things.
But finding what works for you.
Exactly. And I think it's an ongoing process.
Right.
But I've learned that it's not a luxury. It's a necessity.
Yes.
And it allows me to show up for my clients with more compassion.
Yeah.
More energy, more presence.
Yeah. Yeah. And it's a good reminder for, not just social workers, but I think for anybody who's facing, demanding work or emotionally challenging work, that you have to
take care of yourself.
Yeah. And it also, this whole conversation about self-care, it makes me think about, the importance of supervision and peer support.
Oh, for sure.
For social workers as well,
Yeah.
Because I think those are so important.
They are.
So can you talk a little bit about, why is supervision so crucial?
Yeah, so I think one of the main things is that it provides a space for social workers to process the emotional challenges of the work.
Yeah.
We deal with some pretty heavy stuff.
Yeah, you do.
Trauma, abuse, poverty, loss.
Right.
And it's important to have a supportive environment.
Right.
Where we can debrief those experiences.
Yeah.
Explore our own reactions and receive guidance.
Right. So it's like having a sounding board.
Exactly.
To really kind of unpack. Yeah.
Those heavy emotions.
Yeah.
Yeah. And also to get perspective, I imagine, from somebody who really understands the work.
Someone who's been there.
Yeah.
And also I think supervision provides accountability. Right. It helps to ensure that we're adhering to those ethical guidelines and best practices.
Right.
So it's really a safeguard for both the social worker and the client.
And then what about peer support?
Yeah. So peer support's so valuable.
Yeah.
Because it allows us to connect with others who really get it.
Right.
Who understand the unique challenges and rewards of social work.
Yeah.
And so it creates this sense of community, belonging.
Like having a tribe.
Yeah, like a tribe, exactly.
Yeah.
And that can be so supportive.
Yeah.
Especially, when you're dealing with a really difficult case or when you're feeling burnt out.
Yeah, you have people to turn to.
Exactly, yeah. And you can share resources and learn from each other's experiences.
Absolutely, yeah.
It's really amazing, we've been talking about all these different things, but I think there's this, theme of connection that keeps coming up. Yeah. Whether it's the connection with our clients, the connection with our colleagues, even that connection with ourselves.
Yeah, absolutely.
It's really at the heart.
It is. Social work is all about connection.
Yeah.
It's about recognizing that shared humanity, our interdependence, and really believing in the power of relationships to heal and transform.
Yeah, and as we've been kind of, going through these lecture notes, one thing I've also noticed is that there's this theme of challenging assumptions. We talked about challenging our own biases.
Right.
But also challenging societal norms and even challenging these traditional notions of what it means to help someone.
Yeah, that's such a good point. Yeah, because critical thinking is so fundamental to social work.
Yeah.
We're always questioning assumptions, examining power dynamics, trying to really understand those complex social forces that are at play.
And those assumptions can pop up in so many different areas.
They do, yeah.
Of our work, right.
Right.
From how we're interacting with clients to the policies and systems that we're navigating.
Absolutely.
For example, we might assume that, a client who is struggling financially is just like lacking motivation or financial literacy, But when we actually dig a little deeper and challenge that assumption, we might discover that there's actually this whole web of like systemic barriers.
Yeah.
Discrimination, lack of access to affordable housing, limited job opportunities that are all contributing to that financial instability.
Right. So it's about looking beyond the surface.
Yes.
And asking those tough questions.
Yeah.
And really seeking to understand the situation.
Yeah. Yeah. So it's really about,
And I think that critical thinking piece is so important for advocacy as well.
Yes.
We need to be able to identify those harmful assumptions and challenge them.
Yes.
Both within ourselves and also within the systems that we're trying to change.
Yeah. This has been such a really enlightening conversation.
It has.
And I feel like we've barely scratched the surface of these lecture notes, and yet we've uncovered so many layers of complexity, within social work practice.
And, as we wrap up this part of our deep dive,
I
think it's important to remember that this is just a glimpse into this vast and ever-evolving world of social work. So there's so much more to learn and discover.
It's a field that really demands lifelong learning.
Absolutely.
And that ongoing self-reflection.
Yeah.
And a willingness to adapt, right?
Mm-hmm. Because the needs of individuals and communities are constantly changing.
For sure.
Yeah. So for now, let's take a pause.
Okay.
And give our listeners a chance to kind of absorb what we've talked about. Mm-hmm. And we'll pick up the conversation in the next part of this deep dive and explore some additional concepts from these really fascinating lecture notes.
I look forward to it. It's really amazing how, we can have such a deep conversation about, like the core of social work just from looking at these lecture notes.
I know. It's really fascinating. And as we kind of dive back in, I'm curious, like, what were some of the things that stood out to you from the notes? Was there anything that particularly resonated?
Yeah, one thing that really struck me was the section on empowerment and research.
Okay.
And it really highlighted how important it is to involve clients in the research process itself.
Interesting.
So it's kind of moving away from, doing research to clients.
And moving towards doing research with clients.
That's a really interesting point, and it kind of speaks to that collaborative nature of social work.
Right.
Really seeing clients as partners in this process rather than just, subjects of study.
Exactly.
So how does that play out like in practice?
Yeah. So let's say, you're doing research on the effectiveness of a particular intervention program for families experiencing homelessness.
Okay.
So instead of just, gathering data from those families, you're actually involving them in shaping the research questions.
Right.
You're asking them, what aspects of the program are most helpful?
Yeah.
What challenges are they facing?
Yeah.
What outcomes are most important to them?
So you're getting their input.
Exactly. So their voices and their lived experiences are actually informing the research.
And shaping it.
Right. And that can be so valuable.
Yeah.
Because then the findings from that research can be used to actually improve the program.
Right.
To make sure that it's really meeting the needs
of
the people it's intended to serve.
It's really cool. And it makes me think about, that scenario that we were talking about earlier from the lecture notes about the adolescent student who is struggling in school.
Right. Yeah. The one with the challenging family circumstances.
Exactly. And one of the questions that the lecture notes pose was, how much of the intervention should focus on that individual and family counseling versus addressing like those broader social issues.
Yeah, that's always the question, isn't it?
It is.
Where do we focus our energy?
Yeah, and I think that's, it's kind of at the heart of what social work is all about.
Right.
It's like that dual focus of helping individuals to kind of cope with their immediate challenges, but then also working towards these broader social changes.
Absolutely, because we don't want to just help people navigate the systems. We want to actually change the systems.
Right. Yeah, so it's like working on two levels at the same time.
Exactly, yeah.
It's like, how do you empower individuals to kind of thrive within their current circumstances, but then also, like, how are you working to change those circumstances to create a more just and equitable society for everyone?
Absolutely, yeah.
So in that specific scenario with the student, like, the individual and family counseling could help them to develop coping mechanisms.
Right.
Maybe improve communication with their family, address any underlying, like, emotional or behavioral issues,
exactly,
that might be contributing to the struggle. So it's like equipping them with the tools and the support to navigate, like, their current situation.
Exactly.
But then at the same time, the social worker would also be looking at those larger systemic issues.
Right. So simultaneously, they might be exploring, some social justice activities that are aimed at tackling those broader issues like, poverty, lack of access to resources, educational inequities, things that might be putting that student at a disadvantage.
So it's like, are you connecting the family with community resources?
Yeah.
Are you advocating for, better educational opportunities in their neighborhood? Mm-hmm. Are you working on, like, policy changes at a larger scale?
You got it.
It's so inspiring.
It is.
To think about how social work operates on so many different levels,
Absolutely.
From that micro level of, like, the individual counseling to that macro level of, like, systemic change. Mm-hmm. It's really, really powerful.
And I think that case also highlights the importance of cultural competence.
Right.
Because we need to understand how cultural factors might be influencing the students' experiences.
Right. At home, at school, in the community.
At home, at school, in the community, exactly.
Yeah.
And, culture really shapes, our values.
Our beliefs, our behavior. How we perceive challenges.
Yeah, and even how we respond to those challenges.
So a culturally competent social worker would be taking all of that into account.
Absolutely, yeah.
Right.
Yeah, and asking questions like, what are the family's beliefs about education?
Right.
What are their experiences with the school system?
Yeah.
Are there language barriers?
Right.
Cultural differences that might be
creating misunderstandings or conflict.
Creating conflict, exactly.
Yeah.
Yeah, so it's really about seeing that student and their family as individuals within that larger cultural context.
Yeah.
Respecting their unique perspective and experiences.
And making sure that the interventions are sensitive to that, to their values and beliefs.
Exactly.
And, it brings us back to this idea of empowerment.
Right.
We can't truly empower someone if we don't understand and respect their cultural identity.
Absolutely.
And how that shapes their worldview.
Yeah, it's all interconnected, isn't it?
It really is.
The cultural competence, the empowerment.
Social justice.
The social justice.
Even that piece about spirituality. It all kind of weaves together to create this, like, really holistic approach.
Absolutely, yeah.
To helping people.
And that's what social work is all about, right?
Yeah.
It's about seeing the whole person, understanding their strengths.
Their challenges. That complex web of social forces that are shaping their lives.
Exactly.
And then working collaboratively to create change.
Mm-hmm.
As we're talking, I keep thinking back to what you said about self-care.
Oh, yeah.
For social workers, because it's so easy to get caught up.
It is.
In the demands of this work. It's emotionally intense, You're dealing with systemic barriers, so how do you, like, personally prioritize self-care?
Yeah, that's such a good question. And it's something that I've honestly had to learn over time.
Yeah.
Early on in my career, I definitely fell into the trap of overworking.
Yeah.
Taking on too much, not setting boundaries.
Right.
And it led to, some pretty serious burnout.
Yeah.
So what I've learned is that self-care is not selfish.
Right.
It's essential.
Yeah. And I think a lot of people, especially in helping professions, they really struggle with that.
Yeah, they do.
Yeah.
But I've come to realize that if I'm not taking care of myself, physically, emotionally, I'm not going to be any good to my clients.
Right. Yeah.
So for me, it's really about finding activities that bring me joy.
Okay.
And replenish my energy.
Okay.
So it might be, spending time in nature. It might be doing yoga. It might be listening to music, or even just taking a few minutes to meditate each day.
Yeah.
Just quiet the mind a little bit.
Right.
And so it's really about
finding what works for you.
Exactly. Yeah, it's an ongoing process.
Right.
But I've really learned that it's not a luxury.
Yeah.
It's a necessity.
Yes.
And it allows me to show up for my clients with more compassion, more energy, more presence.
Right. Right.
Yeah.
And that's a good reminder for all of us, I think.
Yeah.
Not just social workers, but anybody who's, facing, demanding work.
Yeah. Anybody who's doing work that's emotionally challenging.
Yeah. Yeah. You have to take care of yourself.
You do.
Yeah.
You really do.
And it also, speaking of self-care, it makes me think about, the importance of supervision and peer support for social workers as well.
Oh, absolutely.
Because I think those are so crucial.
They are. They're so important.
So can you talk a little bit about, why is supervision so important in social work?
Yeah. So I think one of the main reasons is that it provides a safe space for social workers to process those emotional challenges of the work.
Right.
Yeah. We deal with some pretty heavy stuff.
You do, yeah.
Trauma, abuse, poverty, loss.
Right.
And it's important to have a supportive environment where we can debrief those experiences.
Yeah.
Explore our own reactions.
Yeah.
And receive guidance.
So it's like having that sounding board.
Exactly.
To kind of unpack all of that.
Yeah, to process it all, to get some perspective from somebody.
Yeah, and to get perspective from someone who really gets it.
Yeah, someone who's been there.
Yeah.
And I think supervision also provides that accountability piece.
Right.
It helps to ensure that we're adhering to those ethical guidelines.
Right.
And best practices. There's really a safeguard.
Right.
For both the social worker and the client.
Yeah. And then what about peer support?
Yeah, peer support is so valuable.
Yeah.
Because it allows us to connect with other people who really get it.
Right. Who understand.
The
unique challenges and rewards of this work.
The challenges and rewards of the work.
Yeah.
So it creates that sense of community.
Right.
Of belonging.
Like having a tribe.
Yeah, like a tribe. Exactly. And that could be so supportive.
Yeah.
Especially when you're dealing with, a difficult case or when you're feeling burnt out.
Right. So you have people to turn to.
Yeah. And also, opportunities for professional development.
Right.
Sharing resources, learning from each other's experiences.
Yeah. Yeah. It's amazing, as we're talking about all of these different things, we've covered, empowerment,
right.
Social justice, self-care, but I think there's this overarching theme of connection that keeps emerging.
Yeah, absolutely.
Connection is key.
Yeah, whether it's the connection with our clients.
The connection with our colleagues, even that connection with ourselves.
Absolutely.
It's really at the heart of this work.
It is. I mean, social work really is all about connection.
Yeah.
It's about recognizing our shared humanity, our interdependence, and really believing in the power of relationships to heal and transform.
Yeah. And as we've been kind of going through these different concepts from the lecture notes, one thing I've also noticed is this theme of challenging assumptions.
Right.
We've talked about challenging our own biases, but also challenging societal norms and even challenge these traditional notions of what it means to help someone.
Yeah, that's such a good point.
Yeah.
Because, critical thinking is so fundamental to social work.
Right.
We're always questioning assumptions.
Yeah.
Examining power dynamics.
Yeah.
Trying to really get a deeper understanding of the social forces that are at play.
Yeah. And those assumptions can pop up in so many different areas.
Oh, absolutely.
Of the work. Right.
Yeah.
From how we're interacting with clients to the policies and systems that we're navigating.
Yeah. For example, we might assume that a client who's struggling financially is just lacking motivation or financial literacy.
Right. Right.
But when we actually dig a little deeper and challenge that assumption, we might find that, there's a whole web of systemic barriers.
Yeah. Yeah.
Discrimination, lack of access to affordable housing, limited job opportunities, that are contributing to their financial instability.
So it's about looking beyond the surface and asking those tough questions.
And being willing to really...
And being open to...
Yeah, be open to a different understanding.
Right.
Yeah, and I think that critical thinking piece is also so important for advocacy.
Yeah.
We need to be able to identify
right.
those harmful assumptions.
Yes.
And then challenge them.
Yeah.
Both within ourselves and within the systems.
Yeah.
that we're trying to change.
This has been such a really enlightening conversation, I feel like.
It has.
We've barely scratched the surface of these lecture notes.
I know, right?
And yet, we've uncovered so many layers of complexity in social work practice.
Yeah, and as we wrap up this part of our deep dive, I think it's important to remember that this is just a glimpse into this vast and ever-evolving world of social work.
Right.
There's so much more to learn.
Yeah, it's a field that demands that lifelong learning.
Absolutely.
That ongoing self-reflection and a willingness to kind of adapt to the ever-changing needs
For sure.
of individuals and communities.
Yeah.
So for now, let's take a pause.
Okay.
And give our listeners a chance to kind of absorb what we've discussed.
Yeah, to process it all.
And we'll pick up the conversation in the final part.
Sounds good.
Of this deep dive and explore some additional concepts from these really fascinating lecture notes.
I look forward to it.
So welcome back to our deep dive into the world of social work. Going through these notes and having these conversations has just been so eye-opening.
I know, me too. It's amazing how much depth there is to this field.
And, as we kind of wrap up this final part of our deep dive, I want to go back to one of the topics that really intrigued me from these lecture notes. And that was the concept of incorporating spirituality into social work practice.
Yeah, it's a big one, isn't it? And it can be kind of a tricky area to navigate.
It is. And, what I found really fascinating was this idea from the notes that, spirituality isn't necessarily about religion.
Right.
But it's more about helping clients to find, a sense of meaning and purpose in their lives.
Yeah, and I think that's a key distinction.
Yeah.
Because for some people, their spirituality might be very much tied to their religious beliefs.
Right.
But for others, it might be expressed in, more secular ways.
Yeah. Like
through a connection to nature or art or community.
Right. And the notes emphasize that, it's not about imposing our own beliefs on clients.
Right. Absolutely not.
It's about creating a space where they can explore their own spiritual needs.
Yeah.
And how those needs might be, impacting their overall well-being.
And how it connects to everything else that's going on in their lives.
Right.
Yeah.
Because the lecture notes also brought up this idea of how, existential anxieties like the fear of death or feeling isolated can really play a big role.
They can, yeah.
In people's mental and emotional health.
And those are really difficult things to grapple with.
Yeah.
For a lot of people.
And people often find meaning and solace in their spirituality to help them kind of cope.
Yeah, to make sense of it all.
So how does a social worker even begin to navigate this really kind of complex territory?
Right.
Especially considering the ethical considerations.
Yeah, it's a delicate balance.
Yeah.
And the notes really highlight, several key challenges, I think, for social workers in this area.
Yeah.
The first one is, being aware of our own spiritual beliefs.
Oh, right.
And how those might be even unconsciously influencing our interactions with clients.
Right. Like we always have to check our own biases.
Always. Yeah. So we have to be mindful of those and really avoid imposing our own values on other people.
So it comes back to that self-awareness.
It always does.
Yeah. And I guess that also kind of connects to the second challenge, right?
It does, yeah. So the second challenge is being sensitive to the client's own belief system and their spiritual needs.
Right.
So respecting their worldview.
Even if it's different from our own?
Even if it's different from our own, yeah. And avoiding judgment.
Right.
We're trying to convert them to our way of thinking.
Right.
It's about meeting them where they're at.
Yeah, creating that safe space where they feel comfortable sharing,
If they choose to.
Yeah. And then the third challenge, I think, was about recognizing, when is it appropriate to encourage a client to explore their spirituality? And when is it maybe better to just focus on other aspects of their well-being?
Yeah, and that could be a tough call.
Yeah.
Sometimes. But I think it really comes down to reading the cues from the client.
Right. Respecting their boundaries.
Exactly.
And not kind of pushing them into something.
Right. Only going there if it feels really relevant and helpful.
Right.
For their overall goals.
Yeah. And then the final challenge, I think, as I recall, was about helping clients to kind of find that meaning and purpose.
Yeah.
To help guide them in making positive choices.
Exactly. And it's not just about, having these abstract conversations about spirituality.
Yeah.
It's about how do they connect those beliefs to their daily life?
Yes.
In a way that feels really authentic and empowering.
Right. So it's about action.
Yeah.
It's about, practical steps. Yeah. So this is reminding me that, spirituality is just so personal.
It is.
And multifaceted. And I think for social workers, navigating this terrain really requires a lot of sensitivity.
A lot of sensitivity.
And respect.
Yeah.
And a willingness to really meet clients where they are on their own spiritual journeys.
Yeah. And it's about recognizing that spirituality can be this incredibly powerful source of strength.
Yeah.
And healing and resilience for a lot of people.
Yeah.
But we have to be mindful of, our professional boundaries.
Right.
And the diversity of beliefs that exist out there.
Well, this whole exploration of spirituality and social work practice has definitely been, it's really added another layer to our understanding of this profession.
It has. It really has.
And it just highlights how social workers are really trying to address the whole person.
The whole person.
Including their spiritual needs as they work towards both individual and societal well-being. As we wrap up this deep dive, I'm so struck by the profound impact that social workers have, on individuals, on families, on communities.
Yeah, they often do the work that nobody else wants to do.
They do. They really do.
Yeah.
And they're often, the unsung heroes.
Yeah, I agree.
Working tirelessly to empower others and to create, a more just and compassionate world.
I couldn't agree more.
This has been such a great deep dive, and it's really been so much more than just, looking at these lecture notes. It's really been like a journey,
It has.
Into the heart of social work, the values, the challenges, the incredible dedication of those who choose this path.
It's inspiring.
It is. It really is. And we've covered so much ground.
I know, right? We went from the micro to the macro.
Right, from individual counseling to systemic change. We talked about empowerment, cultural humility, self-care, the importance of challenging assumptions.
And I think we both have a much deeper understanding.
Oh, definitely.
Of the impact that social workers have on the world.
And so, on that note, I just want to thank you, our listener.
Yes, thank you.
For joining us on this really, really insightful journey into the world of social work.
It's been a pleasure.
We hope that this deep dive has, sparked your curiosity.
Yeah.
Maybe challenged some assumptions and perhaps even, inspired you to think about ways that we can all contribute to a more just and compassionate world.
Thank you for listening.